Alright, so for the next metabolic bone disease, which we'll be talking about, is what is known as a Paget's disease. Paget's disease, right? So you just say Paget's disease, metabolic disease. Okay, so basically we're not here to now be discussing everything about Paget's disease, but since we are saying Paget's disease is kind of like a disease that will affect the bone, we're just trying to look at a link, between this Paget's disease and what any bone stuff that actually happens. So looking at this, you can see how the bone is here, the normal architecture. Why this one, you can see how it actually works. It's bowing out. All right. So we said that Paget's disease of the bone is also known as what? Osteoitis deformans. All right. Of course, there's a what? Deformity here. All right. So it's actually chronic metabolic bone disorder. It's characterized by abnormal bone remodeling. Okay. So in this condition, there's like excess breakdown of old bone, that's osteoclastic activity, followed by what? Disorganized and what? Excessive new bone formation. All right, that's osteoblastic activity. So the result is bone that is what? Structural weak, enlarged, and prone to deformities. You see that? All right. So it occurs due to a disordered osteoclastic and osteoblastic activity. Alright, so osteoclastic activity is usually more than the osteoblastic activity. So it involves increased osteoclastic bone resorption, followed by what? Disordered excessive bone formation, leading to production of weakened and deformed bones of increased mass. Alright, so what are the clinical features? If it occurs in the ears, it results in hearing loss and headache due to overgrowth of the bone and of the skull. Alright, so bone and joint pain, curvature of the spine, alright, can result to scoliosis. Alright, laboratory findings is if you do a laboratory test for like calcium and phosphate, it's normal, but alkaline phosphatase will be so elevated. Alright, so treatment is basically the biphosphonates. Alright, the biphosphonates. Alright, of course, I told you guys that we're not here to now be discussing everything about Paget's disease. We're just trying to talk about the metabolic bone disease aspect.